Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense.
We apologize for the sound quality issues in this episode.
Welcome back to the Equine Vet Connect podcast. We're in here in the old studio, treatment room 1. Got Dr. Caitlyn McCaulley back with me. How are you doing today?
Good, how are you?
I'm doing good. We've got an interesting topic today. We're going to be talking about the older horse.
Yes.
Geriatrics. Yes, geriatrics. I think this is a demographic of horses that's often forgotten. And we talk a lot about athletes. We talk a lot about performance. We talk a lot about those younger horses. But, these older horses, they're a demographic that I think often gets forgotten. And they have some specialized needs.
Yeah.
And that's what we'll talk about today is if you've got an older horse, things that you need to start thinking about. You need to kind of shift your way of thinking just a little bit. Nothing crazy, but a lot of times we hear some stuff that is just not true. Talking about these older horses, so let's dive into that.
And like we talked about in the dentistry podcast, this is a demographic that's growing because horses are living longer now. So I do think it's an important thing to talk about, and we'll get into it.
Absolutely. So one of the questions I often get is, my horse is getting older. Do they still need vaccines? Do you still need to see them? What's your take on that?
Absolutely. I would say, we need to see them just as often as any other demographic of horse, if not more often. So at this practice, we really push physical exams twice yearly for everybody, especially our geriatric guys. And every 6 months is definitely when I would like to see these guys.
I agree. These older horses, they can start to develop different murmurs and arrhythmias as they age.
Yep.
Just like people do.
Yeah.
And so that twice yearly physical exam, that's just one of the things we're looking at. Is listen to that heart. Murmurs and arrhythmias can develop. We need to know if those are there.
Yeah.
And also lungs.
Mm-hmm.
As we age, our risk of asthma goes up.
Yeah.
You can start to have different respiratory issues as well.
Yeah. And just having us look at them, we can pick up on subtle things that are starting to happen before they become a true issue. And so we can start to address those things and just help manage the horses easier. I feel like a lot of times with our older guys, if we can start early, then it becomes much easier to manage them, other than when we wait until we have a big problem and then now we're kind of behind the 8 ball. So definitely want to see them every 6 months and keep tabs on all those changes that are going on.
Being proactive, I think that's probably the theme of 90% of our podcast. Yep. You want to be proactive. You don't want to be reactionary. And I think that's just a good overall thought process in general for any kind of equine care is being proactive.
Yeah.
So one of the questions I also get is, my horse is getting older, does he need to be vaccinated?
Absolutely. Yeah, the vaccines are, we have what we call our core vaccines and then our risk-based vaccines. And your immunity from those vaccines, even if your horse has been getting vaccinated its whole life, the way that the horse's immune system works, that doesn't, just because they've been vaccinated all the way until they were 25, even if you've done it every 6 months like we recommend, that doesn't mean that for the rest of their life they're going to have enough protection against those illnesses to carry them through. So we've got to vaccinate them and basically re-engage or remind that immune system how it needs to function to protect them.
I like that word, remind, because we'll do a whole episode just on vaccines, but just a quick synopsis. We think about titers, and that's the circulating antibodies.
Yeah.
All right, those are great.
Yeah.
If you do have an infection, those are going to get used up quite quickly.
Yeah.
We're relying on a memory B cell after that, and that's one of the biggest things with horses is they don't like to remember. they don't produce a lot of memory B cells. They're not long lived in horses. People, dogs, much, but people have great memory.
Yeah.
Dogs, mediocre memory. Horses, no memory, which if you've got horses, that's kind of a underlying thing.
Well, it's if you look at like tetanus vaccines, for example. So people, we can get tetanus vaccines every 10 years. That's what our recommended schedule is. Horses, you're getting a tetanus vaccine every 6 months.
Correct.
So that kind of shows you just one of the examples that their immune system is not.
No,
It's just not as good. Not that it's not as good, but it's not as
longevity.
yes, that's a good way to put it.
So that's one thing I often talk to people about is I understand your horse has been vaccinated its whole life, but unfortunately or fortunately, we need to continue vaccinating.
Yeah.
It doesn't mean we can slow down on that because, like I said, the memory's not there. And especially as they age, I think that memory gets even worse.
Well, and as you age, your immune system is not going to be as robust, and so even then, if you do contract one of those diseases, you're going to have a harder time fighting it off anyway because you're not a spring chicken anymore.
Right.
So anything we can do to prevent them from getting these illnesses is going to be helpful. So there's multiple reasons why we still need to vaccinate them, but at the end of the day, we still definitely need to vaccinate our older guys.
Well, and one of the things I hear too is my horse just isn't traveling anymore. So do I really need to vaccinate it for our risk-based vaccines like flu, EHV1 and 4? One of the things the question I like to follow up when people tell me that is, well, is anybody in the herd traveling?
Yeah.
Because if you've got horses that are leaving the property and coming back,
they're bringing it with them potentially.
So even though that particular horse isn't traveling, the risk is not going down.
Right.
And influenza, especially in older horses, can lead to a lot of secondary bacterial infections. It can lead to some pretty nasty pneumonias.
Yeah.
So more so even than in the younger horses. If you think about it, it's so different than with us.
Exactly.
You look at flu, the younger population is typically better off than the older population.
Right.
So
right.
We're looking at that risk. It's not just that horse travel, but is anybody in the herd traveling?
Mm-hmm.
So
yeah. But with your core vaccines, those are rabies comes from the wildlife. They're not going anywhere. That risk is not diminished. And then the rest of them are, tetanus is in the soil, so that's always around. And then the rest of your core vaccines are mosquito borne. And the mosquitoes, especially in Georgia, they're not going anywhere. So those vaccines we definitely need to stay on top of. And so we just got to keep on it.
I think an easy way to think about that is your core diseases we're vaccinated against. Those diseases come to you.
Yeah.
Risk, your horse goes to them.
Correct. That's a good way to put it.
So just kind of the way I look at it. So again, we're going to do a whole episode just on vaccines, but I think in general, a good rule is even though your horse is older, even though your horse isn't traveling as much, you still need these vaccines. It's still critical.
Yeah.
So
absolutely.
Another one I get, and we kind of touched on this briefly in an earlier podcast. My horse is older, doesn't have any teeth left. Does it really need to float? Absolutely,
it does. I would say it needs to float more often when it doesn't have enough teeth left to chew with than when it does. When we say they don't have any teeth left, that's when we run into their molars are expiring and their cheek teeth are expiring, and now we've got these occlusal abnormalities, or the abnormalities with the chewing surface. And if we don't stay on top of those, they can really get out of control and lead to some big problems in that mouth. And just being able to look in the mouth and evaluate, okay, can we still eat forage? As far as hay goes, can we still, do we need to change the diet? Do we need to make some adjustments there? But also just keeping them comfortable is a huge thing.
Well, and I think, too, to remember that not every cheek teeth in a horse's head is expiring at the same rate.
Right.
And when we talk about expiring, that means we're running out of clinical crown, the amount of tooth that is actually productive. And if you look at the 09s, the first molars, that is the oldest horse, or the oldest tooth in the horse. However, we have other molars and we have the premolars that are younger teeth. And so, yes, the 9s may be running out of clinical crown. These other teeth are not.
Right.
And so I think that's important to remember that not every tooth in the horse's head is the same age. And so they still need those routine floats. And great point you made earlier. A lot of times they need them more.
Yeah.
Than
A lot of my seniors I try to float twice a year, if not more. So my own horse is, he's a slightly geriatric guy. He gets floated probably every. He probably needs to get floated about 3 times a year because of the way that his incisors wear, and then changes the way that his cheek teeth wear. So we can keep tabs on these things, and we can help to make adjustments, smaller adjustments, several times a year, and that keeps them happier, keeps them healthier, and we avoid problems later on down the road. So,
and again, being proactive.
yeah.
And taking care of those teeth will prevent a lot of things. One is you're going to have better feed and forage utilization,
Which is huge.
Yes.
Yeah.
These guys are already struggling in that aspect. We need to do everything we can so they can utilize that forage and they can utilize that hay.
Yeah. Yeah. The other thing too, a lot of times in our older horses, because we've got the tooth has expired or erupted until it can't erupt anymore, a lot of times they are more prone to tooth root abscesses, fractures, things like that. That can be really painful and really detrimental to overall health. And so if we can keep tabs on those mouths, and we can extract those teeth if they need to be extracted, we can take radiographs, we can get those teeth addressed before it becomes a secondary sinusitis and a whole mess. So,
Absolutely.
yeah.
Because that's one of the things that we're looking at when we're floating. A lot of times when we talk about the sharper points, we talk about some of those enamel ridges that are in the way. But in some of these older horses, it's a tooth on one side that, let's say you have a tooth that's slightly loose on one side, it's pocketing feed around it. That tooth is expired. And because it's painful, they only chew on one side of their mouth. And chewing on just one side of the mouth is going to increase that wear. And so keeping those mouths very comfortable allows just better use of the teeth we do have left.
Yeah. Yeah. And it's huge. I mean, it's dentistry is every time I see an older horse that is a little bit thin, the first thing that I'm going to recommend is a dental exam. So,
and it's amazing how many horses that you see this chronic weight loss in as they get older. We go in, we do a dental float on them, and you almost within a month you see them weights back on. Horses doing much better,
and they're happier overall.
Yes.
Yeah.
Yes, dental health. I've always said, going back, I remember when I was a kid, if you had a 20-year-old horse, you had a really old horse.
Not anymore.
Not anymore. These horses are routinely living into their 30s.
Yeah.
And we've got a few that are bumping 40. We've had some over 40 in practice.
Yeah.
And I think the one thing that's probably the single biggest factor in horses living as long as they do now is good dental care. The focus is put on that dental care. So as horses age, doesn't mean we need to slow down.
If anything, we need to ramp it up a little bit. Yeah.
So make sure you're talking to your veterinarian when they come out, especially when you're getting that float done. If they say, "Hey, I need to see him back in 6 months," make sure you're getting that appointment scheduled.
Yeah, we really do, and we're not saying it just to make another appointment in the books, where it's genuinely because those horses need it, and if we can stay on that 6 months, we'll be much better off.
Yes. Yep. Strongly that I'd probably say that's the one factor that can maintain your horse's health, because that's kind of leading into the next topic, feeding of the geriatric horse.
Yeah.
It doesn't matter how good your hay is, doesn't matter how good your feed is, if you don't have enough grinding surface in the tooth, if the teeth are not working like they should, it doesn't matter the quality you're giving if they can't utilize it.
Right. And feed is expensive, so I always say, to get the most cost efficiency from your feed, you need to have good dentistry. Like, those two things go hand in hand. You're gonna waste more money in feed that's not being utilized appropriately or not being utilized as efficiently, when you could spend the money on the dentistry, and then those two things will just go on forever.
One of the things I tell people is, pay attention to your horse's stall, pay attention out in the pasture, because the horses, they can they start what we call quitting, which is where they're trying to utilize the grass, they're trying to utilize hay, some type of forage. And if because they're not able to grind it appropriately, it sort of gets balled up in the mouth. It kind of sits over on the cheek, and they're not able to get it broken down enough to be able to swallow, and then they end up just spitting it back out.
Yeah.
And it's called quitting. And so if you see evidence of that, that's a pick up the phone, call your veterinarian. Let's go get these teeth looked at.
Yeah.
And the goal is to prevent them from ever getting to that point.
Mm-hmm.
But if you do see that, that's one sign that you know, hey, my horse really needs to float. He's starting to quit. We need to get this looked at.
Yeah. Too, the other thing I'll see is seniors that are, like you said, chewing on one side. Sometimes they'll kind of tilt their head when they are eating.
Right.
They'll kind of hold their head up a little bit, like they're just trying to reposition themselves to put the feed where they need it in their head, and then be able to chew however's comfortable for them. So that's not normal. So if you see that, that's another indicator. Like we probably need to get these teeth looked at.
Very good point.
Yeah.
I'd almost say if you start to see quitting, if you start to see them hold their head in the wrong way, we may have waited too long.
Yeah. Oh yeah.
So that's let's get in there. Let's get this taken care of.
Yeah. ASAP.
And like I said, it's honestly, I do believe the old horse is probably important.
Oh yeah.
So
yeah.
So when we get into feeding,
Mm.
this is a question we get asked a lot when these older horses are starting to drop weight. What should I feed them? What are some of the things you like to consider? What are some of the things that you feel are important when feeding these older horses?
So step one, like we talked about, is evaluating that oral cavity and seeing, what teeth do we have to work with, and then that's going to face a lot of our our feeding recommendations. Really, it's high quality nutrition. So high quality hay first and foremost, because that's what we need to base all of our feeding regimens on is forage first and foremost, and then supplementing in to get the calories however we need to with a type of concentrate or grain. I think alfalfa is wonderful for seniors, and it's people get worried about it making them hot or making them have too much energy, and it doesn't. It's more high in protein than it is in carbohydrates for the most part. So you're not going to get that effect, but it's really quality nutrition, and it's really, I find that they have an easier time breaking that down than they do some of our other grass hays. So I really like alfalfa hay.
I agree. And what you're looking for there is something with a lot of leaf and it's not
Yeah.
very stiff.
Right. Yeah.
And a good rule of thumb when you're looking at any forage, whether it's alfalfa, alfalfa, the fewer the flowers, the better.
Mm-hmm.
I can remember when we used to cut alfalfa and you wanted flowers in it. When you see that flower, it's matured.
Yeah.
So you want to cut before then. So the fewer the flowers in alfalfa.
Yeah.
And then you're looking for very few seed heads.
Mm-hmm.
Because again, when a seed head shows up, that's a mature plant.
Yeah.
So the fewer the seed heads, the better. No, and that's true for Bermuda, Timothy, Orchard, Rescue, Rye, any of those hays. You want very few stem heads, or seed heads. So it's a softer, less lignin, more digestible type hay. And that's I always call that truck window nutrition. You can look at it and you can get some idea, even if you don't have time for or even if hay testing is not available to you. I'm always going to want a hay test.
Oh yeah.
But if that's not available, then that's a real simple way you can evaluate what kind of hay do I have. Mm-hmm. So alfalfa, very few flowers. Your grass hay, you want minimal seed heads. Yeah. Less mature forage, less mature, easier to digest. Mm-hmm. So, but 100% high quality forage. Yeah. That is first and foremost high quality forage. And again, if their teeth aren't working, you can't even utilize the high quality.
Correct. Forage. Yeah. So we're circling back to dentistry every time. But and then the other thing, like we talk about, alfalfa comes in baled hay, it comes in chopped, it comes in cubes, it comes in pellets. And I think your highest quality alfalfa is always going to be your hay.
Absolutely.
I talk about it like with ground beef. So your best cuts of beef don't get made into taco meat; they get made into steaks and filet mignon. Everything else gets ground up and put in your ground beef. So the alfalfa is the same way. Like your best alfalfa is going to be baled, and then everything that's a little bit subpar is going to be ground up and put into your cubes and your pellets and all that. So
I use the same example. If you grow good quality lettuce, you sell it as a head of lettuce.
Yeah.
If that lettuce isn't very good, shred it up and turn it into the taco mix.
And then nobody will know.
Exactly. So again, high quality alfalfa hay
Yeah.
will trump a cube. All of it will trump a pellet.
Yeah.
So again, usually the more processed is typically a lower quality. It's no different horse feeds than the sheep feed.
Yep.
So, which, there is a time and a place for these chopped hays and
Yes.
for alfalfa cubes.
Yes.
If, circling back to dentistry, if we are at a point where we don't have enough grinding surface in our teeth, then we need something with a smaller particle size.
That can be easily, we can soak it and make it softer for them, and then they can swallow it without having to chew it up and make that food bolus. Because once we start seeing quitting, if we don't address that, they can't utilize any of that hay that they're trying to take in. So there is a time and place for it, absolutely, but we wanna use the hay if we can.
Well, and I think there's a conversation I have a lot is fiber versus roughage. Fiber is just a type of carbohydrate. Roughage has to do with stemness.
Yeah.
And the horse's GI tract needs some roughage. And roughage is anything over 1.5 inches long.
Yep.
And shockingly, an alfalfa cube is chopped to about 1.5 inches.
Yeah.
1.5 to 2 inches.
Yep.
So the alfalfa cube or any of the hay cubes, they will allow us to get the roughage into horses that they need. With when we do have teeth that are not able to grind like they should.
Yeah.
So just because it may not be as high quality as a hay,
it can still be useful.
Right, because if you're just chewing the hay up and spitting it out,
That's
it doesn't matter how high quality it is. If it's not getting into the GI tract, it has no chance of providing nutrients.
Right.
So there are times we're going to talk about using soaked hay cubes, and I think they are a very good product to have on hand for these horses.
Yeah. The soaking is important, though. Please don't feed them dry.
Yes, and soaking takes time.
A lot of time. Yeah.
And it's kind of a weird mix in there, right? It's kind of like Goldilocks. You don't want to soak it for too long.
Yeah.
But you don't want to soak it not long enough.
Yeah.
So it's kind of what's your typical guideline?
I try to tell people to get to an oatmeal consistency is what I go for, and it really depends on how much feed, how much you're trying to soak. So what volume or what weight of feed you're trying to soak and what type of feed you're trying to soak. But I typically go for an oatmeal consistency. I know my guys, they both get their feed soaked and they get about half a gallon on their feed, and they're eating about 2.5 pounds of grain per day, well, twice a day. So they get about half a gallon for that. But you kind of have to play around with it a little bit till you get the right consistency.
Well, I think that's important too. Is when you're looking at soaking feed, sometimes you have to break those up into smaller meals more often because it's amazing. You take some feed, you put it like look at alfalfa cubes. That's my favorite.
They go.
Yeah, they blow up.
Yeah.
You throw in like a scoop of alfalfa cubes.
You've got a whole bucket now. Yeah.
You've got a whole lot.
If it's soaked appropriately, you've got a whole bucket.
Right. And so what you run into then is, the horse's stomach can only hold so much before they get hungry or before they get full. So sometimes you've got to do those smaller meals because they'll leave it, and then when that soaked feed's sitting, it's gonna get rancid fast.
Yeah, especially in the summertime, it'll ferment and get really nasty. So, but yeah, I tell people to go for an oatmeal consistency with the alfalfa cubes. I want them to be completely broken up. I don't want to have any. I want to be able to run my hand through there and not have any clumps, like not have any cube left intact. I will get in there and mix things around and break them up to make the process go a little faster. But it really depends how much you're trying to soak, and warm water helps. So
yes, it does.
Yeah.
And to me, this is especially important when we get into some of our complete feeds that are beet pulp based.
Yep.
Beet pulp needs water.
Please.
The number one, I think every time I cleared a choke when I asked people, it was either some type of a senior feed, it was beet pulp. Something that involves beet pulp. That seems to be what most of our chokes.
Loves to ball up and get stuck.
Yes.
Yeah.
And so please soak these complete feeds, and especially if your horse is able to chew as it should.
Yeah.
You need a lot of water.
And so when we talk about a complete feed, that is a feed that is designed to be fed to horses that can no longer eat hay.
Correct.
And so these are designed to have enough fiber and have enough calorie content and be balanced that the horse can eat only this and get everything that it needs. We're still missing that roughage component, but we do get to some horses that they can't process it. So
Well, and when you look at a lot of these complete feeds, you have to look at the bag and see what rate they were designed to be fed at, because it's a lot.
It's a lot. It's very much. And so when we get into this, you're looking upwards of 18 to 20 pounds or more, and so that definitely needs to be broken up into at least 3 feedings. And so when we get to managing these guys and feeding, you do have to change your routine a little bit sometimes. But it's worth it. It does work. So
One of my favorites is a feed designed. One of Professors University of Georgia designed it. Nick Godfrey's a feed company at Lionsly make it. We call it American Feed, but it's actually designed to be fed free choice.
Yeah,
they can't overeat on it.
Yeah,
that one I've never had a need to soak it, just because the consistency is it's not high in B12. It looks a little strange because it does use cottonseed milk.
Yeah,
and if you're not used to that.
The first time I saw it, I was like, "What is that?" Yeah.
Growing up in Georgia in a pretty heavy cotton environment,
Well, see,
I was used to seeing cottonseed.
When I moved down here the first time, I saw cotton. I was like, "Whoa!" And then I realized they round bale it, and I was like, anyway.
Yeah, I think you're talking about peanuts there.
No, it was cotton.
You don't round bale cotton?
They had round baled it. They round baled something.
It's peanuts.
I don't know.
I've never baled cotton.
Well,
I've baled a lot of stuff.
It looks like cotton. So, but that tells you we don't grow peanuts or cotton in Ohio, so I have no idea. I just saw it and I was like, oh, I'm so confused. Anyway, that was a tangent we didn't need to go on, but
true. And let's talk about that real quick. So you're talking about peanut hay.
Oh yeah.
All right, let's talk about that really quick. There's 2 kinds of peanut hay. You have perennial peanut hay, which is actually grown as a hay crop, and it actually looks and feeds very similar to alfalfa. Perennial peanut hay is really good for horses. Then you have peanut hay. And peanut hay, when you go through and you combine the peanuts, you're left with the vine the peanuts grew on. That is not good to feed to horses. This stuff's loaded in sand. It's not a good horse feed.
Yep.
Stay away from regular peanut hay. Perennial peanut hay, very good. And if you're in the southeastern U.S., perennial peanut hay is probably the closest thing we grow here to an alfalfa. It actually is. It's in the same family as alfalfa. In a lot of cases, it almost looks like alfalfa. It's got little leaves on there. It's got stalk. It looks very similar to alfalfa. So know the difference between those as well. Because if your vet says, "Hey, maybe we need to get a more perennial peanut hay," this is not the peanut hay that comes from growing peanuts. This is an actual peanut hay that's grown as a hay source.
Yeah.
So know the difference there. But so yeah, when we're talking nutrition again, these complete feeds feed at a higher rate, which means you're going to need multiple feedings throughout the day.
Yep.
Sometimes if we're able, we'll actually let these horses eat free choice, because older horses get a little finicky about eating.
Oh yeah.
Sometimes they want to eat, sometimes they don't. They
Yep.
don't want to come in and eat big meals anymore. They kind of go back to their more grazing type habits.
Yep.
So if we have a way to segregate these horses out so they can have more of that grazing on these complete feeds, I think it works much.
And definitely want to give them ample time to eat where they're not competing with other horses. They're not stressed about eating, because they do have a lot of feed to get through, and it takes time.
Right, especially your teeth aren't maybe not working as well,
or they're painful.
Yep, it's going to take a little more time to get through. So.
Yep.
So another thing that we often get asked about when we're doing these twice-year physical exams, your vet's probably going to talk to you about it, is blood work.
Yep.
And there's a couple of things for we got regular blood work, and then we've got testing for Cushing's.
Yep, those are our big things. Yeah, I do really, for our senior horses, I do like to do a complete blood work once a year for them. So doing a CBC, which is going to tell me about red blood cells, white blood cells, and platelets, and then doing a serum chemistry, which tells me really about overall systemic health. So liver, kidneys, proteins, muscle enzymes, all of these things can kind of clue us into, are things, are we going well? Do we have any red flags? Do we have anything that we need to watch or look into more. Just kind of gives us a nice overall view of everything that's going on. And so I do like to do that once a year, especially if we're on any type of long-term NSAIDs or things like that that can affect liver and kidneys. And so I do like to check on that. And then definitely Cushing's testing, which I feel like we talk about every time I'm here.
Yeah, just one thing just to touch on briefly. If your horse is on some of these long-term NSAIDs, equioxy is a very common one.
Yeah.
You know, to me, if you're doing that, we're going to bump up that twice a year.
Yeah.
We need to be looking at those, those kidney values and those liver values.
Yeah.
To know, can we continue down this path? Mm-hmm. So Cushing's testing, we did a whole episode. If y'all get a chance, and if you got questions about Cushing's, I would say to go back and look at the episode we had on metabolic disease.
Yeah.
So,
I will say a lot of these older guys that the owners are like, oh my gosh, they're so skinny, they're so skinny. Really, their body condition, which is looking at fat cover, is okay. They're they're around a 5, which is where they should be, but they're losing muscle, so they're losing top line, they're losing gluteal muscle. That's muscle wasting and muscle loss, and that can be a contributor from Cushing's. So that's one thing that I'll kind of clue into and say, yep, we need to test for this. And so there is a difference between weight loss, muscle loss, fat loss. All of those things they're not the same. So kind of having your vet out again twice a year to keep tabs on those things and clue into those is really helpful.
I think that's important too, because if you look at a horse every day, you don't see those subtle changes.
Yeah.
You see them twice a year, like, we're trying to drop in muscle tone.
Yeah.
Very important distinction you made there. Is it a fat issue? That's a calorie problem.
Yep.
Is it a muscle issue, which goes back to a protein problem?
Mm-hmm.
Protein or amino acid issue. That can either be from not enough in the diet or poor utilization.
Yeah.
And that's, as we've talked a little bit about nutrition here, as horses age, their utilization of some of these proteins is not as good as it once was.
Right.
And Cushing's has a huge effect on that.
Yep.
Again, we're not going to spend too much time on that today's episode. Go back and watch that. Go back and listen to the podcast on Cushing's, because we really go into depth there.
Yeah.
Talking about it.
Yeah.
Yeah, absolutely. Those are the 2 blood tests that come to mind. And there's some things that will clue us in on that routine screening that we may get the results back and go, hey, we got some things on here we need to go check for Cushing's. We may not have seen it on a physical exam, but some things on blood work may indicate, hey, you may be dealing with early stage Cushing's.
Yeah.
So,
yeah.
Get the blood work done.
Yep.
So the other question we kind of briefly touched on here was the long-term NSAIDs, such as Equiox. Just like in people, as horses age, our joints don't work near as good as we used to.
And when it's cold and it's rainy, they'll get stiff and they'll get sore just like we do.
Right.
Yeah.
So what are some things that you like to talk to people about?
So it kind of depends on the history of the horse. Were they a performance horse? Have they gotten joint injections? Like kind of what was the history there? But I really do, for my older guys, we talk a lot about joint supplements. We talk a lot about NSAIDs and things like that. My go-tos for my older guys are one of the polyglycan products, so Adapon or Legend, and then I do love Equiox. So the Equiox it's an NSAID, a non-steroidal anti-inflammatory, just like your Bute or your Banamine, but it is what we call a selective COX inhibitor, so it's a little bit safer to be on long-term because you're knocking out the bad parts of the inflammation without knocking out the protective mechanisms of the prostaglandins. So
I always like to say it's safer.
Yeah.
I think that's a good way to put it. It's
safer. Yeah.
It's not safe, and a lot of people think that Equiox doesn't have any ill effects, but it can have. It inhibits COX-1 less than buterbanamine, but it does still inhibit it, and that's the one we need for GI protection and also kidney function.
Yep.
So, again, it's not perfect. It's much better than buterbanamine.
Yeah.
But there are still risks with it.
Which is why we want that blood work to check on those kidneys. Yep.
And I 100% agree with you. You know, we often think about things like Adequan and Legend. We often think about that in performance horses or younger athletes, but it is still a great product for older horses. I think it may even work better in some of those older horses than it does the younger ones.
Yeah.
And I often get asked about oral joint supplements, and you know the data is not real great that those are helpful.
Mm-hmm.
And if you actually look at your cost,
Mm-hmm.
you can treat with Adequan or Legend for about the same price as an oral supplement.
Yeah.
And it works.
Yeah. And we have the data that shows that it works.
Yeah.
So, yeah, I tell these people the same thing. I'm like, there's a million different joint supplements out on the market. None of them have, scientific studies that tell us, are they being absorbed? Are they going where they're supposed to go in the body? Are they working? We don't know. Some people have anecdotal success with some, and some people have better success with others. But by the time you've tried 3 and you're still like, I don't really know if I see a difference or not, we could have paid the same price and done Adequan, and we have the data. We know that it's absorbed. We know that it's going where it needs to go, and we know that it's doing what it's supposed to do. So, yeah, wholeheartedly agree.
And one of the things you kind of touched on is joint injections, and I talk to people about this all the time. It's not just for performance horses, it's not just for athletes. If you've got an arthritic joint in an older horse, you can inject it. I mean, grandma gets her knees injected.
Yeah.
You know, whether she's a tennis star or not, sometimes grandma's knees, they will help.
Yeah.
The same thing with these older horses. It's not the wrong thing to keep to inject the joint off.
Yeah, and we have a lot of products that we can put in there. We can put hyaluronic acid directly into the joint. We can put some cushioning for that cartilage surface. We can help that joint to function better with an injection. So there's definitely a place for it for sure.
Absolutely.
Yes.
It's one of the things that I talk a lot about. We've got a lot more options than we used to have.
Mm-hmm.
And a lot of these people really, really well older horses.
Yeah.
So don't just because your horse may not be performing doesn't mean we may not need to inject that joint.
Yeah. Going along with that too, I always get asked questions about exercise and can we keep riding them? Like, what can we do? And just like in people, if you spend a rainy Saturday sitting on your couch and you don't get up and do things and you've got some arthritis, that evening or the next day you're going to be stiff. Horses are the same way. We like to get them out. We like to get them moving. So I try to not stall these guys. I try to give them the option to come in if they want to, but let them walk around, let them move, let them do. If they're sound and they're happy, take them out on a little trail ride.
Absolutely.
Like, get them moving. They can go and they can do, and as long as they're comfortable, I think movement is better. We're not going to ask them to go do a 5-star cross country course, but they can go out on a little hack, and movement is medicine in my opinion. So
no, one of the things I see in my barns is you've got these older lesson horses. And these horses are in their mid-20s, and they're still doing lessons, but they've kept these horses in shape. They've done the things they need to do.
Yeah.
And those horses, you'll look at them and you're like, he's 25, and he looks 15.
Yeah.
But they've kept them moving, they've kept them exercised, and just like in people, exercise is medicine.
Yeah.
It's important.
Yeah.
And so don't, just because your horse hits a certain age doesn't mean, I should stop riding.
Nope.
The horse doesn't know how old it is.
Oh, yeah.
They have no idea it's when their birthday.
My horse is going on 25 and he thinks he's 10. So he'll go buck you off in a heartbeat if you pick him the wrong day. So.
And with that, I think it's also important when you do ride, you do need to take some age into consideration.
Yes.
Warm up is important.
Yes.
Don't jump on and just go right into it.
Yeah.
You need to spend some time warming them up. You need to spend some time getting everything moving. Those light hacks are great. And
consistency.
Yes.
Consistency, like, we're not going to go out on a 5-hour trail ride one weekend after we've not worked them for weeks and weeks. You want to be consistent and do these smaller amounts of exercise more consistently.
Yeah, I mean, 30 minutes of exercise a few days a week.
Great.
Fantastic.
Yeah.
So keep these guys moving, and I think if you keep them moving, they do not age as fast. And it's so different. Like, we've all seen people that stay active, and it's like they never age.
Yeah.
And then you got the person that retires, sits on the couch, watches TV. and they go downhill quickly.
Yeah.
Horses are no different.
Yeah.
So keep them exercising, keep them moving. And I think that's when we do consider some of these things. Like if we need to keep them moving and keep them exercising, consider things like some injections, consider Avalon, consider Equiops, because if we can add that in to make them more comfortable, and we can keep those horses active, they live a longer, happier, healthier life.
Yeah.
So.
Oh yeah, for sure.
You've got a lot of ways we can. Your veterinarian can help assist you keeping your horses active and keeping them healthy. So.
Yeah.
Also important for cardiovascular health.
Yes.
We talk about joint health, but again, cardiovascular health, exercise is important.
Yeah, if you keep them fit and you keep them moving, it goes a long way, and I think they're happier too. I mean,
Yeah.
Horses, a lot of horses enjoy having a job, so even if they're just toting your grandkids around, like it's something.
There's still a lot of life there.
Yeah.
You can still make a lot of money.
Yeah, I
The
think
job may change.
Yeah, but that's okay. I think I have a huge soft spot for the geriatrics. They're some of my favorite demographics. Like they've gone and they've done their whole life, and we owe it to them to keep them moving and keep them happy and healthy. And so they're some of my favorites. I love them.
I agree. Working on a lot of sport horses, I don't get to see as many older horses as I used to, but it's always kind of cool when you see that horse that's had this amazing career. And I think the coolest thing to me is you see him teaching that next generation of rider, and dressage they call it the schoolmaster.
Yep.
He can do it with his eyes closed, just stay out of his way.
Yeah.
He's got this.
Just hold on.
and you think about the amount of knowledge they can transfer to that next generation of rider. And again, I'm like, I've got that soft spot.
Oh yeah, I love them.
Because they have done so much for us, and that's when we get to do it. We get to pay it back. We get to say thank you.
Yeah.
And I think you're 100% right. They're just, the job may change, but they still love them.
Oh yeah.
The thought of retirement for me, I know luckily it's not going to happen for a long time, but I couldn't imagine retiring. And I think a lot of horses are the same way. You watch people try to retire these older horses,
And they're like, well, can I come? Like, what's going on?
I'm not here. Like, I get to go.
Yeah.
I want to go.
I think too their personalities change too as they age. I feel like they get a little ornery and they get a little cantankerous, and they're just funny. Like I just love them. I just think they're a hoot.
They really are. I enjoy these guys. So talking a little bit about something else that's important is farrier care.
Mm-hmm.
I think that's really important for these older guys.
Keeping these guys balanced, keeping these guys trimmed regularly is super important, especially as we age and we do, if we do have some arthritis, we're not gonna travel as appropriately as we might, because maybe it hurts to flex your fetlock all the way, or maybe you don't want to flex your hock, so you're gonna drag your feet a little bit, and you're gonna, have some different wearing on those feet, and so it's definitely important to have your farrier out regularly, balance those feet, help make them as comfortable as they can.
A lot of people ask, like, he's not doing as much, can I pull shoes? I'm like, absolutely.
Oh, yeah.
We can definitely take the shoes off.
Yeah.
And I always tell them, so talk to your farrier. Your farriers are a great source of information on horses' feet. They're seeing them all the time.
Mm-hmm.
And it's interesting because you talk to some of these guys, like, oh, he's wearing different than he used to. They pick up on that.
Oh, yeah.
You may think they're getting under there and just trimming, but there's a lot of thought that you don't see that goes through their minds. They're looking at the feet like, oh, wow, you're wearing more on the inside of the foot than you used to.
Yeah.
And that could be a sign of something going on, and it could be a place where we may need to get proactive. Or he normally stands really good, but he really doesn't like to stand anymore.
Yeah,
so,
and that's a big thing too. That's another place where NSAIDs can be helpful. Is like if your horse does, it's hard for them to stand for the farrier. It's hard for them to hold that stifle inflection. It's hard for them to do that. Now, we can help them with some NSAIDs, kind of pre-med them and get them through that trim, but also cue in to say, hey, maybe we need to look into this a little bit.
Right.
Yeah.
That's something we have to. I've had to do that on a lot of older horses when I was shoeing. I had to call and let the owner know when I was on the way, and they get a gram of butane or 2 grams of butane, and just make it a little easier for them to bend and flex. If you think about us, I don't bend and flex like I used to. Little NSAIDs and I bend and flex a whole lot better.
Yeah.
And it's okay to use them sparingly.
Yeah, it is. They're definitely. I mean, I equate it to us, taking a good old dose of ibuprofen when we're a little ouchy. So it's basically the same thing. So it definitely has a place.
And that's another thing too is using some NSAIDs before you have that exercise routine.
Mhm.
You may not need it every day, but let's say when you are going to go on a big trail ride, pre-med.
Yeah.
I mean, I do that sometimes with like, ooh, I got a strenuous day on the farm.
Yeah.
Maybe I pre-med with a little anti-inflammatory.
Yeah, get them on board, get them working a little bit for so we don't have to play catch up. Yeah.
So talk to your veterinarian. There's a lot of things we can do to help keep these horses active. So,
Yeah. Yeah.
Husbandry. There's a few changes there. You've already talked about one, trying to let these guys out moving more.
Yeah, keep them out and moving. And then blanketing is something that can change as well. So as these guys age, they're not using those calories as efficiently. So we want to use those calories to power the horse and to do nutrition. If we can kind of shunt those calories away from like generating body heat, that's going to be helpful. So, keeping a blanket on them when it's colder, my horse, I used to never blanket him, and now that he's in his mid 20s, I'm like, well, he's gonna get a light sheet on if it's rainy and 40 and he's out in the wind. So I do try to blanket these guys a little bit to just conserve their energy, conserve their calories, just help them stay warm. That's something that can change for sure.
Especially if you're looking at some of these guys that don't have the weight in the wintertime that you'd like them to have.
Yeah.
They don't have that body condition to combat the cold. I find that blanket to be a huge benefit.
Yeah, because then, like I said, you're not using those calories to generate heat, stay warm. You're using them to try to get some of that weight back on, or at least maintain. Yeah.
So as we're coming to an end, if you can give horse owners, let's say 3 tips, if you do these 3 things, you're going to cover 80% of what you need to do. What are the 3 tips you can give somebody for caring for them?
I would definitely emphasize dentistry is huge. It plays a factor into everything that we've talked about for the most part. Definitely having your vet out at least twice a year to keep tabs on them and pick up on subtle changes that you might be missing. And then I think that management is everything. Just small, it doesn't have to be monumental changes, but just small changes in your management and your husbandry and your routine can make a huge difference for these guys.
Again, it goes back not changing how we think, changing how we see.
Yeah.
So how do you see the horse? What things can you do to benefit?
Yep.
Well, I think that was a really fun episode. I really enjoyed. Like I said, I've got a soft spot for older horses. I know you do too.
Oh yeah.
So I think there's a lot of great things in this podcast. So thanks for tuning in. Really appreciate you out there, listeners. If y'all have got questions, send them in. Y'all been sending some great ideas. I promise we're trying to get to them. We've just had so many great ideas for podcasts that it's taken some time to get to all of them. So
we will crank them out.
send them in, and
we need more hours in the day.
I know. So send us an email, a DM. Again, Dr. Caitlyn is still waiting on her letter.
Yeah, I still haven't gotten one.
Somebody write that letter and put a stamp on it, send it in. We'll get some swag. So thank y'all for tuning in, and we'll see y'all next week. Thanks.